Okay, so we're live. Can go ahead with your welcome.
Good evening, everybody. Welcome to ATP Live once again. It's good to be back. How are we all doing? How was the day? Trust we all have a stress-free day. So today we have our CEO with us, President of Dr. Gbemisola Boyede, and we will be taking your questions very soon. But before then, can you please invite your friends and family to join us? You can as well share this on your social media on Facebook, on Instagram, on Twitter, and if you are on YouTube as well, please kindly inform your neighbors, your sister-in-law, the grandmoms, the mom-in-law to join us. It's another section to ask as many questions as you have. Our CEO in person of Dr. Gbemisola Boyede is ready to take all your questions. Once again, welcome to Ask the Pediatrician Live. Good evening, Dr. Gbemi. You're welcome to the show.
Hi everyone. On Facebook, on Instagram, on YouTube, on our group, on our page, wherever you're watching me from this beautiful Monday evening. I say welcome to ATP Live. I'm trying to press some buttons, make sure we share the video to all the platforms so that everybody can watch. So this is a time where you can ask your questions live and direct. Usually on Ask the Pediatricians, you can always access your questions on our Facebook group for children, on Ask the Pediatricians, and for adults on ATP Family Facebook group. So, but this 1 hour session, you can actually get your question live and direct. So feel free to share the video, invite friends and family, and join myself and Abimbola as we begin to take your questions. For those of you who are on Instagram and you can see Abimbola, trust me, she's here. She's on Facebook, and you can hear her voice. Just let me know if you can hear her
Yes.
voice. But I'm the one with you on Instagram today. So feel free to start dropping your questions because we just got an hour, and then after that, that will be all over for today. So you are all welcome to the show.
So, welcome, Esther Chooks. Thanks for joining us. Good evening. Please kindly share the links with your friends and family. Nora McCarthy Iwokoye. Good evening to you too. You're welcome. Thanks for joining us. I can see your name, the third person that just commented. I absolutely love this group. We as well love you, but we love your children more than you do love us. So thank you for joining us. And please
Okay.
invite your friends and family.
I'm not so sure I
Thank
can
you.
see the video on our Facebook group. I'm looking for it. And
Oh, okay.
like you can see it on the Facebook group. Can you pin it up so that we can? I don't know why I can't see all the pin. I want to pin it to the announcement section, but I'm struggling to find it on the group. Yeah, maybe I need to remove some announcements aside.
Okay, ma'am. Uh, so while we're waiting for Dr. Gbemisola to pin our video on Facebook, you don't have to wait. Let the questions start rolling in. We have just 1 hour. I repeat, just 1 hour. So you don't have to wait. Please drop your question. Let them start rolling in. As soon as she's done, she's going to join us and we can start taking all the questions one after the other. So Esther Olofiji Tijani, good evening to you too. Thank you for joining us. Good evening, please. I don't know your name. Don't be offended. I'm seeing only Facebook users.
Yeah, those are
So
the people commenting on Facebook. Those are the people in the group. And I'm looking
okay,
for,
ma'am.
I don't know why I can't see them. Okay, so if anybody is in any of the moderator is on the group, can you kindly pin the live video so that we can put it to the announcement section? I can't seem to find it. Okay, yeah, I think this, I've seen it now. Yeah,
Okay,
I've seen
ma'am.
it, don't worry. I don't know why
Okay,
it
thank
went
you, ma'am.
down so low, but I've seen it now. Yeah.
Okay, that's very
Yeah.
good, ma'am. Yeah, we do.
Okay, good,
So,
lovely. Um,
We are good to go, everybody. The questions are already coming in, Dr. Gbemisola. So
Okay,
I
I
think
just
we can start
let
right
me
away.
just make sure this is a pinned to the top in the announcement section. Okay,
Okay.
I think it's pinned to the top already, just to be sure.
All right, ma'am. So welcome everybody once again, and thank you for joining us on Ask the Pediatrician Live today. So today we have our CEO, Dr. Gbemisola Boyede. She's the one that will be taking all your questions. Don't forget child-related question. If you have any adult related question, you can paste them on our sister page, Ask the Pediatrician Foundation. Family,
For
thank you
children.
so much. I'm seeing some questions here. So when you are asking your question, please endeavor to let us know the age of the child, the birth weight, and the current weight. So, Dr. Gbemisola, are you ready?
Okay, we can go. I'm still struggling, but it's fine. Let's just start
All
because like
right, ma.
video is
Okay, ma. Thank you so
I
much.
think
So,
people need
people
to,
are already dropping questions. So,
yeah.
we
But
have
if any of
quite
the
a number of
moderators say
people
it, you can
watching.
just pin the video for us because I'm not
Okay.
sure why I can't seem to get it. But I know people are on it, but usually I like to put this in the announcement section so that people can easily see it. All right, we're good to go. Okay, so do you
Okay,
want me
ma.
to start on Instagram? Okay, you know what? We have just one question on Instagram right now.
Okay,
And
ma'am.
so I will
Can we
just
just take that first?
yes, I think I will just take that because I usually struggle with scrolling on the
Okay.
Instagram thing. I always wish somebody could join me to scroll and read. Um, Sorry. Okay, thank you so much, everybody on Instagram. I can see you are. Okay, so Irene Temi is asking, my baby of 15 months hasn't started to eat normal family food. What do you think I can do? Have forced things several times, but it doesn't accept. Okay, so this is the most favorite question people ask me on all right, am I the one displaying this? Let me remember. So this is the most
Okay,
favorite
that's
question people ask me all the time, anytime I come on live. I think the question of what is my baby is not eating or my baby is not eating, what baby should be eating is the most frequently asked question directed to any pediatrician at any point in time. So if you are a pediatrician, you've never been asked that question, it's very unlikely you are one. And usually the issue is that sometimes from my own experience, I would say it's lack of information. Either parents leave the process of starting complementary feeding too late, or they didn't do it right way, and this is always the issue. So we're always back and forth, and then when it is the time you expect baby to not be eating family food, baby is struggling, and that was because at the time you're introducing it, the baby is no longer interested. So I'll just summarize by saying for the first 6 months, we want you to feed your baby breast milk only. And one of the advantage of doing exclusive breastfeeding is that your baby is also being introduced to your food because whatever you eat, the flavor of it is also being introduced in the breast milk. So babies who I know that a lot of you people believe that babies who are on breast milk don't like to eat food. Actually, research says the opposite because they've actually exposed to tasting their mother's food right from breast milk. So they are likely going to accept family food more than babies who are on formula feeding. Now, the issue is that when it is time to introduce complementary feeding, parents think complementary feeding is formula or pap. That is the issue from my own experience with Nigerian mothers. Complementary feeding is not pap, it's not formula. That is not it. And because every time people ask, oh, maybe it's now time for complementary feeding, oh, which formula should I buy? And I'm like, you don't even need to buy any formula ever. And some people are like, oh, my baby is not taking pap. Why? My baby does not ever need to take pap ever. It's not compulsory. So complementary feeding means you are introducing other food, the food that you are eating to your baby. But of course, when you are introducing a baby who is on what look like liquid food, which is breast milk, you are not going to go from 0 to 100 immediately. So you're not going to start giving the baby eba or pounded yam the very first day you're going to start complementary feeding. So you're going to start with solids in form of semi-solid like porridge and then after that you graduate the baby to adult food. So, and then you don't start the baby on only pap or cereal that you buy in the stores and stay on that, which is what most parents also do. They give the pap and the formula for 6 months to 1 year, and then all of a sudden they expect the baby to start eating the rice or the yam, and then they're surprised the baby is not taking it. I mean, some people do bottle feeding. I've seen 3-year-old going to the nursery with bottles. And this is one of the reasons I say don't do bottle feeding ever at all. So from 6 months, you start your baby on the cup and on the spoon, and you start them on your own food. You can mash your yam, you can mash the rice, you can mash the potato, you can do all those things. It doesn't have to be pap only. You can do pap, of course, and it has to be thick pap, not through the bottle, through the spoon and the cup. And then, of course, it should not be just one food. It has to be a mix of several foods. So you have the carbohydrates, you have the protein, you have the fat and oil, you have the fruits, you have the veggies. You must put all this together, and you don't have to give the same food every day. So something different in the morning, something different in the afternoon. You have to do it separate. And the amount you also give when you are starting to introduce new food, you're not going to go from zero to because your baby is taking 120 minutes of breast milk doesn't mean your baby is going to take 120 minutes of pap or cereal or whatever you're going to give, because it's a thicker food, it's solid food, it has more calories even in that little quantity. So usually for when you're starting, you start with something as small as 1 or 2, 3 spoons for the first day. So, but some parents, because you start 1, 2, 3 spoons, baby doesn't take that, you think, oh, baby doesn't finish 120 minutes, that means baby is not accepting that food. But that is not true. So when you're trying new food, you start with a small quantity and then you gradually build it up. And then, of course, usually at that age, they don't need as much complementary. They don't need the complementary food to replace all the breast milk. It is still breastfeeding, but you are now adding. So you are adding more food. So when you first start 6 months, it's just maybe 2 extra meals of complementary feeding. You still keep breastfeeding as before, and then you now go on and gradually increase. So we say maybe 50 meals, that's okay. Twice a day, that's okay. And then but you still keep breastfeeding. You don't reduce breastfeeding, you don't stop breastfeeding, because some people just say, praise God, breastfeeding is over. It is not over. You have to keep breastfeeding, and then you're adding other food, and then you keep trying new food. You keep adding to your repertoire of recipes. So those are the ways to go about it, and you have to do it patiently and persistently. So if you don't do it and you're looking for, some babies are very good, you just give them anything, they jump onto it, and that is it. Some babies are not like that. So you got to be patient and introduce. But if a child at 1 year is not yet taking family food, I would say that it is our fault as a mom, because you have not really followed that process of complementary feeding properly. You have been very comfortable giving the usual things that baby can easily take, either cereal through the bottle and all that. Then all of a sudden, the baby is very comfortable with that, and they don't want to take solid. So, but it's not, hope it's not lost. You can still do it, but you're going to do it, and you're going to start it patiently, and you follow through. That's what I normally advise for such mom. We have the Global Health Media. They did a lot of videos on complementary feeding, what to give, how to give it, how often to give it, what not to give, because some mothers also give other things. You give your baby junk food, the biscuit, the milk, the juice, all those things fill up the baby's stomach, and then they don't, and it's very sugary and very sweet. So they don't want to take the real food. So if you're giving them an alternative, they're not going to eat the real food. So you have to take off the junk food. So because I see people asking me questions, can I give my 6-month-old biscuits? Can I give my 6-month-old this? And I'm like, okay. Then later you come and say, my baby doesn't want to eat food. He only wants to eat biscuit and tea. Why? Who started the baby on the biscuits? Who started the baby on the tea? The baby does not know there's anything called biscuits or anything called tea. You started the baby. So this is the thing. So I always say, please have the right information and follow through on the right information. There's a process of called eating well. In fact, they design what they call eating well plate. If you Google it, eating well plate or my plate, it shows you how to mix the food. So if you go to our Facebook group, we have the guide section, and we have all those videos there. Or if you go on YouTube and Google Global Health Media videos, they also have a app Birth and Beyond, where all those videos are. I always encourage mothers, daddies, everybody to watch those videos because they are very simple and they did the video using your local food. You don't ever have to buy anything in the shop for your baby to eat food at all. Never. You have everything your baby can eat in your own kitchen. That is the truth. So there's really no reason for you to spend any beyond money. Like there's no baby. I always say there's nothing called baby food. There's nothing called adult food. Food is food. It is the way you mix the food. It is the way you prepare it. It is the way you package it together. That is what the people that are selling you had the so-called baby food. That's what they've done. They've gone to their own industrial kitchen, put it together, put it in a tin, and they're selling it to you. That's what they've done. So it is something you can do. And yours is even fresher, more organic, straight from your kitchen is better. So this is it. So if you are new to the group, because if I want to talk about complementary feeding, I can talk about it the whole day. But I think if you watch those videos first, and this is an answer to all those who are going to ask the same question, because I know I'm going to get asked this question every day, every time. So please go to the group or go on YouTube, watch those videos and follow through them. There are also a lot of food recipes for babies and all that online that you can use. Just experiment with it. I know it's not very easy. We are busy mothers. We just want to give the food, pim, and then dash out. But unfortunately, you have to just be patient as you go through this process. But once you master it, of course, that is it. Of course, that's not to say there are some children that are not fussy eaters. Some children are fussy eaters. You don't have to force them to eat. But at least they should still have, if it's 4 or 5 food they will eat, they should still have those ones that they can eat. And then you can give them more of what they like. But you have to make sure it still has all the components of what make a complete food. In other words, you can't give only one particular, maybe it's only carbohydrates or all the time. No, you have to make sure everything is inside that one meal at a time. So I think that will help. So don't give up, or start now. A 1-year-old should be eating from your pots, should be eating whatever the rest of the family is eating. That is our expectation, and you can do it. If you are still bottle feeding, just go and throw away the bottle first. That's the first thing you need to do, and make sure you begin to offer and keep trying and be patient with the process, but I'm sure you will get there. Thank you so much. Okay, so I think I've answered.
Thank you so much, Dr. Gbemi. That is a very deep answer to complementary feeding question.
Yeah, because
actually,
rights of all the
she has
mothers.
gone on our Facebook page. She will have gotten a lot of answers just like this.
Okay,
so we have quite some.
Yeah.
Okay, ma'am.
Just Lara, let me just take the next 2 or 3 on Instagram, then we can move to Facebook. So Ayomide is asking, my 8-month-old doesn't have teeth. Should I be worried? No, you don't have to be worried. Some babies don't have their first tooth until 1 year, so it's nothing to worry about. Usually at 1 year, you should see your dentist for the first dental check for the baby. All right, and then I think that's all. Okay, so let's go to Facebook now.
All right, thank you so much, ma'am. So somebody is watching from Abuja. Thank you for joining us.
Somebody said I cannot hear. I hope you can hear. If everybody can hear.
Please, can you hear us? Let's know in the comment section.
Okay, if you can't hear on Facebook, please let me know. I think people on Instagram can hear me. Okay, so this is the first question.
Yes, ma'am. Please, doctor, my daughter is 2 years and sweats more than an adult. Is it normal?
Okay, so I mean, I always want to sorry if I ask you question back to your question, but I always want to know what does it mean to sweat as an adult? I mean, is there a way an adult sweats different from children? I'm not so sure. Lara, how do adults sweat? Okay, but
sweat is sweat, ma'am.
Okay, I get what you meant. Your baby sweats excessively, and so the first question I normally ask when people ask question about sweating is how does your baby sleep? Is the room well ventilated? Do you have the AC? Do you have the fan? Because sometimes, I mean, most of us live in Nigeria, and we know Nigeria is hot, and some of us sometimes we don't have light. So if you are living in that situation, the baby will be hot and will sweat. But if your baby is sweating under a condition, maybe other people are shivering for cold, for example, maybe the room is in AC, I mean with AC, and it's cold, and you are shivering and the baby is sweating, then I will worry about that. And then that is when I will want to see, I want to say go see a pediatrician, because there are some conditions like what we call like thyroid hormones. If they are too much or things like that, they can make somebody to sweat. There are other conditions, or some children have some condition like tuberculosis or some particular cancers and all that. They are not very common things, but you must have excluded the fact that your baby is not sleeping in a very hot heated room before you say the baby is sweating excessive. There's nothing wrong with sweating, but if the baby is sweating when everybody is shivering for cold, that is when we will worry, and that is when we will say you should see a pediatrician. Okay.
All right.
Thank you.
Thank you, ma'am. So, question again. What causes jaundice? My 1-year-old baby boy cannot see it and crawl up to now.
All right, thank you so much for that question, Facebook user. So those of you on our Facebook group, if you want your name to show, it's better you go to in the post announcing this video. It tells you need to click on Facebook/StreamYard. So you give StreamYard the permission to reveal your name. So you have to click on that. If not, it will show as a Facebook user. So what causes jaundice? I guess you mean in a newborn baby, because if you are referring to your 1-year-old who is not walking or crawling, who is not sitting or crawling, you are telling me the baby must have had severe jaundice, and that may have caused some brain injury, and maybe that is why your child is having what we call developmental delay right now. So what causes jaundice? Jaundice is the most common condition in a newborn baby. 60% of all babies we have jaundice. 80% of babies that are born premature, we have jaundice. So it's a very common condition in babies. I don't want to go into the reason why, but summarily, the babies has more red blood cells than they need when they are born, because when they are in the womb, they have to steal oxygen from the mother, kind of. So they need a lot of red blood cells, which is what carry oxygen. But when the baby is born, baby cannot breathe in oxygen. So they have too much red blood cells. That's why babies are always born looking so red. And they have to break it down. So they break down the excessive red blood cells. And those red blood cells also don't stay too long like the red blood cells of adults. And then the liver has to clear out the broken down red blood cells, and one of the end products of the broken down red blood cells is what we call bilirubin, which is what that pigment that makes baby look jaundice or look yellow. So most babies will have that jaundice in the first few days when you, and the liver itself is still immature in a newborn baby. So because of that, they have what we call physiological jaundice, and so which will clear on its own, doesn't require any treatment. But there are also certain conditions that can make the red blood cell broken down to be too much, or that could make the liver not to do the work properly, and too much. I mean, in other words, you are producing so much bilirubin, but the liver is not able to clear it out on time. So if you have condition where you are producing too much bilirubin and the liver cannot clear it out on time for any reasons, then the baby can have the baby can have what we call pathological jaundice, or jaundice due to other reasons apart from the initial reason that affects the 60% of babies. Now, such conditions include things like if the blood group of the mother and the baby is not the same, compatible. If, for example, the mother is O positive and the baby is A or B, the mother's blood, if it's mixed with the baby, the antibodies can break down more of the baby's red blood cells. That can cause jaundice, or babies with rhesus, what we call rhesus incompatibility. So, or babies who are born premature, or baby who have infection, or any condition affecting the liver like biliary atresia. There's so many conditions. There are lots of them. But the issue with jaundice is not that there's jaundice. Jaundice itself is not the problem, because jaundice will eventually clear. But if the jaundice is produced too much and it is not cleared, it goes to the brain of the baby, actually what we call the unconjugated kind of jaundice. If the bilirubin goes to the brain and it can damage the brain of a baby. So what do pediatricians do? We monitor your babies for jaundice. If you think the jaundice, we and this monitoring is not by looking. We take blood and we check the level, because jaundice, it is difficult for people to recognize jaundice, and even when you recognize jaundice, it could be quite decisive. So it's better you take sample and know, oh, this level is okay, this is a level that is not to worry, go home. But some people don't, they may have jaundice, they don't go to see pediatrician, they don't take blood tests, they just say, oh, it is it's jaundice, put the baby under sunlight, give proper water, do all those things. Of course, the jaundice is going to clear. That is not the problem. The problem is that before the jaundice clear, as it got into the level that has caused a brain injury, that is the problem. So when you see pediatrician worrying about jaundice and running head to scatter and taking blood, and some of you mothers, you hate us taking the baby's blood. You call us vampires, like, why are you drinking my baby's blood? We are not drinking your baby's blood. But we need to know the level of jaundice. We need to know whether, can I just watch? Or do I need to put baby under light, phototherapy light? Or do I need to quickly change the baby's blood? If the jaundice level is like 20, for example, in a big baby, a term baby, we need to take out the blood. So we take out the blood that is full of jaundice and put in a fresh blood that has no jaundice. Because if not, the jaundice goes to the brain, and which is what I'm suspecting is happening in this user. The Facebook user who is asking this question, because sometimes we change the blood, but if the injury to the brain has happened, that is it. We can't reverse that injury to the brain. And such babies may have what we call cerebral palsy or delay in the achieving developmental milestones. Or even some babies could have other issues, they have these abnormal movements and all that, or even deafness, hearing loss and everything. So please, if your baby is jaundiced, you must. Usually, most hospitals in Nigeria don't, like some of the teaching hospitals, we don't discharge your baby until 3 days. Those of you that always screaming, I want to go home, I want to go home. This is one of the reasons, because most of those severe jaundice will show up in the first 3 days of life. So if they show up, we are ready, we are checking. And when we check once, we check again, because you need to check to make sure it is not going up. It can still go up before it will come down. So we have to be checking and tracking it. But if we check and it's coming down, we can relax. But if it is not coming down, we have to intervene, especially if it is going above what we call the normal level. We know the physiological jaundice, the normal jaundice, we know how it works, how it goes up and goes down. But if it's going above the level of the normal kind of jaundice, then we have to treat the baby. So I always tell mothers, jaundice is an emergency. Until we do the blood test, until we know the level, until we know whether we don't need to treat or we have to treat, we can't say it is okay. So don't just say, I will just be putting the baby under light. Don't just say, I'll be giving proper water. Please, if your baby has jaundice, you must see a pediatrician. They must take blood. Don't go to see general doctors, because most of them don't know how to manage jaundice. Apologies to some of the general doctors. Some will just give you ampiclos and tell you go home. Ampiclos is not the treatment for jaundice, please. Because all these people that have been given ampiclos is not the treatment for jaundice. Ampiclos will only come in if your baby has infection as the cause of the jaundice. And even apart from the ampiclos, your baby still need to get the treatment for the jaundice itself. So giving your baby ampiclos, staying home and feeling comfortable, it's not. Every day, I am a developmental pediatrician. When I run my clinic in Nigeria, this is the common story every time, because I'm the one that sees those children when they already have brain injury. Then you come to my clinic. And it's always the same story. We went to the hospital. Oh, the doctor gave me ampiclos. Oh, I was put under morning lights. The injury has been done, and I cannot reverse that injury. We can only support the baby. So it is preventable if we treat jaundice well. So there was a time UNICEF, and I think they were putting a lot of advert jingles on the radio and all that, because people seem not to know that jaundice is an emergency, and we really need to make sure we don't allow jaundice to cause brain injury. And for those whose babies escape the injury, congratulations. But please, don't give that same advice to other people, because their own children may not be as lucky as you are. This is the problem we have sometimes in Nigeria. You gave your baby purple water, nothing happens to your baby. That does not mean something is not happening to another person's baby. Maybe your baby just has physiological jaundice and doesn't even require any treatment anyway. But some other person, their baby is going to have brain injury and is going to end up with cerebral palsy. Definitely. So don't listen to other people tell you this is what I did for my baby. Please take your own child to the hospital and let it be treated properly. Sorry, I went overboard on that, but it's a very important information that
Yes,
everybody
yes,
needs to
very
know.
important information. I
Yes,
want
thank
to ask a question, ma'am, concerning the jaundice. Is it ideal for a mother to request for the jaundice test, even when it's not showing, before being discharged?
you. In some hospital, they will do it for you anyway. In fact, some hospital is part of their routine check before your baby goes home. They check the jaundice level. And so, but if you as a mother you want it, you can ask for it. But usually the pediatricians, ideally, every baby should be examined by a doctor. That's another thing. Some babies go home and people ask questions. I'm like, did the doctor ever see your baby before you went home? And I don't know.
Mm-hmm.
So every baby born should have what we call a baby check before they go home. That means a doctor is looking at that baby from head to toe. They are counting the fingers, we are counting the toes, we are checking whether there's a test, the testes are in the balls are in the scrotum, because I've seen babies without any testes in the scrotum, and no, the parent didn't know until baby is 11 years old. The testes are gone. They are gone forever. So these are the things that pediatricians will be checking when we are checking your baby. We are listening to the heart sound, making sure your baby doesn't have a heart problem, so that if it does, we can do the right thing before you go home. So these are the things that must be done. This is why you can't have your baby at home. This is why you can't have your baby in the church, because you need to see a doctor to examine your baby and to take a decision on the right thing. So some hospitals routinely do jaundice tests. Some don't, because we try to check it ourselves. And we only, in these days, there are technology that we can check the jaundice without taking blood. So if this is not so high, we won't bother taking blood. But if it is high, then we will now go for the blood test to confirm it. So, but it's up to you. But my own is, if your baby is discharged home early, because those are the babies that tend to have the issues. If your baby is discharged home before 48 hours, 72 hours, make sure you go back to the hospital for just a check, just to make sure your baby doesn't have jaundice. If you are not sure, it's better. But if possible, let your baby stay home, stay at the hospital until they are sure there's no jaundice. If they need to test, they need to test. Don't just get carried away with doing naming ceremony. Make sure that your baby doesn't have jaundice. Most of these mothers come to us after the naming ceremony, because the parents
Mm.
want to do naming ceremony first before they go to the hospital. These are real life stories. These are babies I've seen. These are the stories mothers have told me. And I always tell them the baby health is more important. You can name your baby while baby is in the hospital. That baby
Yes.
needs to be alive. I mean, that's when the name will make meaning anyway. So please always seek for appropriate care. Thank you.
Thank you so much, ma. Thank you, ma. Faith Nwosu, good evening, ma'am. My baby of 3 months hardly wakes up at night to eat. She wakes up sometimes just twice between 10 p.m. and 5 a.m. to eat. And she eat like just 5 minutes each time she wakes up. Doctor, is it a must that baby must wake up at night to eat? And is the 5 minutes fed enough for her? Cause I feel she's losing weight.
Okay, so what do you say baby is eating? Baby on breastfeeding. So when you're asking for babies, always tell me what they are eating. I always like to know, because it's very it matters. So some babies from 3 months begin to sleep longer at night. So some babies have different pattern of usually babies who are on breast milk, they tend to breastfeed every 3 to 4 hours. So which means your baby should breastfeed maybe twice at night. And at that age, they are also more efficient suckers. So even though baby suck for 5 minutes, because they are more efficient than when they are newborns, they have more energy, they can drain the breast so quickly, so they can empty it so quickly. But you will feel it if your breast is full and you start feeding and you feel that breast goes, free, like flat, and emptied, then you know that the baby has sucked. So if your baby is sucking like twice a night is fine, and the baby is sucking well. But more importantly, the weight of the baby, it will tell you whether your baby is eating enough. So it's not enough for you to feel that your baby is losing weight. You need to check the weight. Every baby should have their weight checked monthly in the first 1 year of life. They must be checked. That's why when you go for immunization, they check the weights. They must check it, they must document it. If you feel your baby is losing weight, you must go to the hospital, they must weigh the baby, because that weight tells us the baby is getting enough food or the baby is not getting enough. If baby is gaining weight, even though you feel your baby is not eating, that means baby is eating enough to gain weight, and that's what we want. So it is important for Hamalachuku, get your baby to the hospital, let them weigh the baby. If it is breastfeeding, like I said, depend on some babies. Some babies suck more at night, some babies suck more during the day. But usually, averagely, most baby will suck every 3 to 4 hours, and that's all. That's still okay. It doesn't have to be 20 minutes or 1 hour sucking. No, if baby is very efficient sucker, they can empty the breast in 5-10 minutes, and that's okay as well.
Thank you, ma'am. Thank you. So, another Facebook user is asking, my baby of 8 months is coughing. He isn't running temperature, and I don't see any sign of illness. What's wrong?
So baby is coughing. Yeah, baby is coughing. That's what is wrong. So the question, I think, what you want to ask is, why is the baby coughing? That I cannot answer. There are many reasons why a baby could be coughing. Baby could have viral infection, baby, allergies, anything. So there are many reasons why a baby is coughing. But without seeing your baby one to one, asking a lot more questions, I won't be able to answer that. So what I would say is that most we have just viral infection, especially during the cold season and all that. So all you just need to do is nothing. Just watch the baby. If the baby is been exposed, if the baby is going to crouch, it's exposed to other people coughing, and baby could also catch infection from that. So you are the one that really need to figure out why your baby is coughing. If you are not sure, you can also take baby to the hospital. But what I would say that if your baby is having difficulty with breathing or fast breathing or high fever, then that is when you really need to go to hospital, because we need to make sure baby doesn't have pneumonia, which is one of the killer diseases in children, and we need to do something about it. But for you, you need to figure out where is the cough coming from. Has the child been exposed to somebody with coughing? Is it coming out when the baby is exposed? Maybe you're flitting your room, you are cooking, there are a lot of fumes. Those are the things that tend to, create irritation and could make the baby cough. Cough is actually not a problem. Cough is a normal reflex. It's the way the body is trying to clear out any unusual thing in the airway. So that is what cough is. But if the baby is coughing persistently, then we now need to know why the baby is coughing persistently. So I hope that is helpful. All right, let's go on.
Okay, thank you, ma'am. I'm trying to check it.
So this Facebook user is saying my baby is 2 days old, birth weight is 3.6 kilos. Doctors say he has jaundice, it's under phototherapy, it's running temperature. So 37.4 is not temperature, that's normal temperature, it's not running temperature. And he keep regurgitating after feeds. Maybe you are overfeeding the baby. I'm not yet lactating, so it's on NAN1. So for your baby, this is another error. This is a important. You have not asked any question anyway, but I'm going to answer. I'm going to address the concerns you've raised. If you are not lactating, giving your baby formula is not the solution, because the way breast milk operates on demand and supply. If you don't demand breast milk, nothing will come out, nothing will be produced. So if mothers are waiting to see breast milk before they breastfeed, but the breast milk is waiting for you to breastfeed for it to flow. So we always get this confusion all the time. You don't need to see milk before you put your baby to the breast, because the milk is going to flow when your baby starts sucking on the breast. It is what we call the milk lets down. The milk lets down up. See, the milk has been produced, it is stored, and but there's an hormone that needs to kickstart it flowing. So you need the baby sucking on that breast for that milk to flow. So if you think, oh, I'm not seeing breast milk, then I'm not going to breastfeed, you are delaying the milk legs down. That is what you're doing. Whether you see breast milk or not, keep putting the baby to the breast. That is number one, because it is the sucking of the baby on that breast that is going to make the milk flow. Now, for a baby who is jaundice, it's even very important that you breastfeed that baby, because the breast milk is important. It has this uh like relaxation, laxative effect, and allow the what we call the meconium, the stool of the baby that is stored, to be let
Come
out.
on.
And if that stool doesn't come out, it also contains a lot of bilirubin, which I was talking about earlier. It causes more jaundice to keep circulating. So when you have a baby, don't look for milk. Put your baby to the breast. Within the first 1 hour, that baby should be sucking on the breast. If baby is sucking on the breast, the milk will flow. Two, the milk produced in the first few days of life is not white. It is not white. It is colostrum. And it tends to look more like water or pale yellow. So don't look for white milk. So some people are producing colostrum, but because they're not seeing white milk, then they think they are not lactating. You are lactating, but you're producing colostrum, and it is not white milk. It is more yellowish or like water. And it is the best thing for your baby in that first few days, because it is the baby's first immunization. It is not sour milk. Please don't throw it away. It is colostrum. It contains antibodies. It contains protective factor for your baby. So please let the baby suck on it. Don't run to formula. Keep breastfeeding. Keep giving the baby the colostrum, and then other things will follow. So the Facebook user, your baby is already under treatment by your doctor. So relax, just relax. The reason why you need to relax is not because I'm just being nice to you, but you need to relax because the hormones that produce breast milk, if you are stressed up, the stress hormones work against breast milk production, the
Mm.
cortisol and all that. So the more you worry, which is what is common with new moms who can breastfeed, who can lactate, the more you are not going to produce breast milk. Is unfortunately is that is true. So when I always say relax, people always think, oh, Dr. Gbemi just trying to reassure me, but I'm actually telling you the solution to your breastfeeding. You need to actually relax. Just tell yourself you got this, you can do it. Your baby, you that's why you are pregnant, that's why you are the baby. Your milk has been your breast and everything has been prepared for this process. Stay near your baby, keep calm, keep breastfeeding. You can do it. And as long as you are doing it, your milk will flow. But if you are stressed up, you're worried, don't worry. Like I told you, your baby is jaundice. You didn't tell me how high the jaundice is and all that. But at least you're under a doctor who is doing the right thing, who is treating your baby. So relax, relax. The pediatricians have got you, and your baby will be fine. So, but please just let the baby suck on your breast so that the milk will flow. And I'm sure your baby will be fine. So there's no need for you to worry and to panic, and don't overload the baby with too much nan. Maybe that's why the baby is having the milk coming back. So just try and make sure the baby, I mean, the nurses, the doctors there, they'll be able to guide you on the volume to give your baby. And keep the baby upright after feeding before you put the baby flat, which is one of the reasons they have reflux. All right, let's move on. Our time is running.
Thank you so much, Ma. So our time is fast spent. So Jennifer Ozigbo Eyiri.
Mm,
Good evening, doctor. Good evening. Good to
mm,
see you again. I read your post on the use of
mm,
Orutivin in
mm,
babies has been wrong. I've
mm,
been using it for 1 year old. I
mm.
asked for nasal drop at the pharmacy, and that's what I was given. Is
Okay.
nasal drop different from saline drop?
Yes. So this is another challenge we have, and I hope my pharmacist colleague are listening to me. And I hope the mothers are listening to me. I see I addressed this issue maybe 2 or 3 days ago. Please, if you go to a shop, if you go to a pharmacy shop and you ask for A, if they don't have A, please don't take B from them. Actually, when you're buying for children, please don't take B. Saline nasal drop is not Otravin. Otravin is a steroid nasal drop, and it's not meant for you to be even using in babies. So it can only be prescribed for you by an ENT doctor. So if the ENT doctor is prescribing it for you, that is fine. But please don't go and buy saline nasal drop and they don't have saline nasal drop, then they give you Otravin. That is wrong. And please, the pharmacists, let's stop doing that. Let's stop, because I know people are trying to sell their products. It's good to sell product, but please don't cause harm to a child in the process of making commerce. It is wrong, and we all know it is wrong. So saline is not Otravin, because Otravin is a steroid, and we don't want the children, the babies, to take steroid. The nose is blocked with mucus, and you just want something to soften it. That's all. If they don't have saline nasal drop, buy the saline drip. That drip, the big one, there is the same thing that is inside. It's only that you don't need so much of it. So that is why it's better to buy the smaller one that already come in drops. But if they don't have the drop, most Nigerian pharmacies sometimes don't have it, then buy the saline, normal saline itself, the one that can cover it, so that when you puncture it, you can still cover it, and then you can just drop it in your baby's nose and then cover it and throw it away when you're. The essence of the saline drop is to soften the mucus so that the mucus will flow out. Otravin is used for children who has got maybe allergic rhinitis or some other condition that requires steroids. Please don't go and be giving your baby steroids. And you know, Nigerian mothers, some of you will keep using this thing all the time. You won't even use this for 1 or 2 days and leave it. Every time you just go and be dropping it in the nose, and you're causing. Steroid can cause so much harm to children when they don't need it. You know, steroid even on the skin. That's why, and that's another story entirely. For those who tend to buy all this steroid cream, Vista Plus, all those, what's other thing? Hamalara remind me, and you be putting it to your baby's cream. You're causing harm to the babies. It can cause peptic ulcer. It can cause their thin skin. It can cause reduced growth. It can cause so many harms to babies. So please avoid products that the pediatrician has not prescribed. Things like steroids should not be used without prescription. In other places in the world, you can't buy those products without a doctor's prescription. But in Nigeria, anything goes. But it's wrong. We all know it is wrong. And I'm looking forward to that day where you cannot buy Ampiclos in our pharmacy shop without a prescription. That is how it works even in Ghana, in Togo. These small countries, you can't do it. Yes, even as a doctor, you can't go there and just pick those drugs. It must be prescribed. But in Nigeria, everybody does do as we like. But it is wrong. But I'm not even worried about the commerce part, but I'm worried about the harm that we're going to cause to our babies. And please, if you have not been asked to use something, don't go and use it and keep using it, please. And we as mothers, one of the child support strategies is female education. One of the strategies to make sure that our children don't die is female education. I'm not talking about female education about being a doctor or not. It's about going to school normally. They found that children of mothers who are educated, secondary school education and above, they survive better. You know why? Because you can read. You can read. That is all. So you can read for yourself. So if you go to the shop and you want to buy saline drops, if they give you something that saline drop is not written on it, don't take it. Insist on what you want. If you don't have it, fine, leave it alone. It's better that way. So I hope I've and if you go to our Facebook group, I have a picture of both drops. There's a saline drop, and like I said, the saline drop is just the salt and water. It's just the normal table salt that you eat and water. You can even make your own, but it will not be sterile. So that's why it's better to buy in the shop. And if they don't have the small drops, buy the saline drip. Use it and throw it away. So it is better that way than to buy steroid drops and cause more problem that the child does not have before. Thank you so much.
Thank you so much, Dr. Gbemi. We have less than 15 minutes.
Okay, fine. So
So,
let me see whether I still have questions. I think the Instagram people are just listening and enjoying the whole thing.
oh,
They are not
okay. On
asking.
Facebook, we have quite numbers of
No,
questions.
but
I don't
let me
know if
just
you can
quickly
finish
clear
them.
the ones we have on Instagram. Then I can come back
Okay, ma'am.
and deal with Facebook, so that for
All right.
Instagram people will not be upset with me. All right. Okay. So somebody is asking, my baby has tongue tie. Is there an issue? That's Khadija. Now, tongue tie is another thing. Please let a doctor see your baby first and confirm the tongue tie, because all this tongue tie is a very common thing. People just give that diagnosis of tongue tie. Most time, tongue tie doesn't cause any harm. Doesn't make your baby not to talk. If your baby has speech delay, don't say it's tongue tie. Your baby is even 9 months old anyway, so there's no need to worry. But if you worry about it, please let a pediatrician see the baby and be sure it is tongue tie, and then they will decide. Most of the time, you don't need to do anything. Please don't go and cut anything because you want to cut tongue tie. Most of you actually create more problems for the baby that way. All right, and then Ijoma is asking, please, can I make my baby to eat refuse pap, frisogo, nutri? Okay, Ijoma, you are late to my question because your question is the first question I answered. So please watch this video all over again because I don't want to repeat the answer, but I've answered your question in details, because exactly what I was saying about complementary feeding, because all those things you listed, your baby don't need to eat all of them to have complementary feeding. So um you should listen to this video all over again, and I've given you guidelines on how to go about complementary feeding, and if you follow it, you will have no issues. All right, so because of our time, I'm just going to run through the Facebook questions.
Yes,
uh
ma'am.
7-year-old daughter who snows at night, have blocked nose. I asked, but a nose, she might have small nose. No, it is not because maybe have it's not because your baby has small nostrils that your baby is snoring at night. This baby may have what we call adenoids or tonsils that are enlarged. And some of them are so bad they need to be removed. So please, Facebook user, take your baby to a hospital to see a pediatrician or an ENT doctor. Let them examine the child. They may need to do what we call nasal x-rays and be sure, and then they will tell you what to do. Thank you. Um,
Thank you, ma'am.
Sakina, my baby birth weight was 1.9, at 9 months, 6.5. So, for those of you whenever you ask question about preterm babies, you need to tell us the age of the
Mm,
pregnancy when you have a baby, because we need to calculate their corrected age. So you say your baby is 9 months, but your baby is actually not 9 months. Your baby is 9 months chronological age. But because your baby was born earlier, let's say your baby was born at 8 months or 7 months, we need to deduct those extra months that your baby was born earlier
months, yes.
to calculate the corrected age, and their weight and their development is measured against their corrected age, not their chronological age. So don't panic, because I know you're 9 months old, your baby is weighing 9 kilos, but baby is weighing 6.5. Your baby may not actually be 9 months, for example, your baby may be 7 months old corrected age, in which case
Yes.
6.5 may still be okay for that baby. So you really need to tell us the age where you have the baby. Okay, so Esther wants to know more about bronchopneumonia. So that is a whole
Yeah.
topic on its own. It's just an infection within the lungs for babies. So if you go to our Facebook group, we have done group discussion on
Yes.
pneumonia. I would
A
advise,
lot of them.
yeah, just put this question on our Facebook group as a separate question, not under this particular one. Then one of our moderators will give you the link to the pneumonia group discussion. Then you can read everything about it, what causes it, how to prevent it, and how to treat it as well. But it's a very important question. Thank you. Um,
Thank you.
Another Facebook question, my baby urinates a lot. If your baby is a 4-year-old is urinating 4 times in 30 minutes, there is a cause for alarm. Yes, there's a cause for alarm, because number one, is it that the baby is passing a lot of urine, Or is it that the baby is just passing small amounts of urine but having to go frequently? So we need to know which of them. So for example, your baby is passing so much urine, then we are worried about things like diabetes, insipidus, or mellitus. Babies can have diabetes as well. Or if it is because it's passing small urine and it's painful, or there's this, if we have to be sure that baby doesn't have urinary tract infection. So you definitely need
Infection.
to see a pediatrician. We need to check that urine for do a urine test. And then and then some babies just drink too much water, and that's why they are passing too much urine. So, but 4 times in 30 minutes, even if you are drinking, I think that's a lot, and you need to see a pediatrician to sort it out. Okay, can tight diaper cause rashes?
Cause rashes to a baby.
Yeah, well, not rashes, but tight diaper will leave mark on the baby, and if you don't change it frequently, of course, you can have rashes. So, but why do you want to wear tight diaper for a baby? Please
Mm.
wear age appropriate size. The size is according to the weight or to the age of the baby, so you need to stick to that. Some 4-year-old having tiny rashes at the tip of his finger, near the nail. The part is looking as if it is eating deep in the finger. It's scratching him. Sound like maybe something like an infection on that finger. So you may want to see a doctor for the treatment for that. All right. Adeoye is saying my daughter is 3 by June. She has not started talking, and her walk is not yet balanced. Wow. And she do fall when walking. Yeah. So I'm worried about your baby, Mr. Adeoye. So you need to take your baby to see a pediatrician. A 3-year-old should be walking without falling. A 3-year-old should be talking. I think you should be talking sentences. So I'm worried about the development of your baby, and that requires further evaluation. So you really need to see a pediatrician for further advice.
Yeah. So,
Okay,
Dr. Gbemi, we have 4 minutes more
okay,
to
thank you.
go.
I'll rush through. And somebody's asking, my baby
Okay,
doesn't
ma'am.
like sleeping on her back. When I try to lay on her back, she'll wake up again and blah blah blah. You didn't tell us the age of your baby, even though Abimbola reminded you to always do that. But
Yeah.
please, baby should sleep on the back. I know some babies like to sleep on their tummy because that either because you started them that way or they find it more convenient. But because there's what we call sudden infant death syndrome, and research have shown that babies who sleep face down are more at risk of dying from that condition. So we want your baby to sleep off the back. So what you need to do, put the baby back on the back and try and rock the baby a little bit, and the baby will sleep. After a while, consistently doing that, the baby get used to it, and the baby will begin to sleep on the back. If you want to read more, I think we have some articles on our Facebook group about
On
sleep.
Facebook group, even on our app too.
Yeah, so if you put it on the group separately, somebody will give you the link to that, and then you get the answer to that. All right, Esther say 20 kg good weight for a 5-year-old, good. 30 kg too much for a 5-year-old. 20 is okay. Actually, it should be 18, but 20 is still within normal. My baby has kata for a long time. Always include the age of your baby in every question. So if your baby is
Yes.
having recurrent kata, you treat it, keep coming back, then your baby may have what we call allergic rhinitis. So you need to see a pediatrician for further support. But meanwhile, if you know what are the trigger factors, then you want to avoid it as well. Romoke, when should the baby start crawling? 9 months. 9 months. But some babies never crawl. They bottom shuffle, but average baby crawl at 9 months. When do we introduce pepper? Pepper is not calories. So pepper, I know Nigerians, we are pepper loving people, but please, just make the pepper not to be much in baby's food. I mean, even you, most of you eat pepper, you start drinking so much water. So why do you want to subject a baby to that? And it's not as if it's giving the baby any calories. So reduce the pepper. You can start from 6 months when your baby start eating normal food. But please, pepper should not be much. It should be little or none at all. It's better that way. But you can start from 6 months. Doctor, what are babies that don't like breast milk? Or my baby stop breastfeeding when he's 3 months old, all I can do, blah, 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 blah. Okay. Most of the time, this issue of baby stopping breastfeeding, most of the time is because we didn't breastfeed well the right way. Baby not probably being attached to the breast, mixed feeding, formula feeding, bottle feeding, nipple confusion. Those are the issues. In other places, we have people that they call lactation consultants. Most of the nurses in Nigeria do it very well. The midwives, they will guide you because breastfeeding
Yes.
is an art. You have to know how to breastfeed. If you go to our Facebook group, we have a breastfeeding guide section. There are a lot of videos on how to start the breastfeeding, how to attach your baby to the breast, how to make sure your baby is sucking well. If your baby is sucking well, most of them will not stop breastfeeding. Most babies stop breastfeeding out of frustration of not getting enough, or because you have been
Breast
giving
milk.
them bottle feeding. Then they prefer, because bottle feeding is less stressful for the baby, especially when you have made that big hole in the teeth. The milk is just rushing. So why would the baby struggle to suck something when there's one that is just going to flow directly? So those are the reason for that. If your baby stop breastfeeding suddenly, you should see a pediatrician, because it is not the typical thing for a baby to do. And the doctors can help you to re-establish breastfeeding. So I won't want to go into the details. I always like um to ask what really went wrong and all that. Yes, our time is almost up.
Oh, our
Uh,
time is up.
okay, this is a prayer. Thank you. My baby, age 9, have stomach pain in the morning. You don't need to deworm them every 3 months. It's every 6 months. However, not I don't know why Nigerian mothers always saying abdominal pain, worms. There are many causes of abdominal pain. If your baby is always having abdominal pain in the morning, only in the morning, it could be school anxiety. That's a common name. Why is it only in the morning? Check them. Do they have abdominal pain in the morning during the holidays? Check that first. If they have it during the holidays, then we also need to check what time do they eat breakfast. So are they, very hungry in the morning, like they're having like what we call gastritis, peptic ulcer, and all those kind of things. So there are more questions we need to ask you, but it's not worms. Sometimes anxiety about school, stress about school can make children to have abdominal pain. It's the commonest reason why people have pain in the morning. Constipation, if they are not passing stool
Yes.
regularly. So these are the common things. So especially when it is very
Sometimes when they are hungry, they tend to say they are having stomach pain.
exactly. So Facebook user, we need to ask you more questions to be able to tease out, but it's not even warm. Stop the warming them every 3 months, every 6 months is fine. Your baby takes tea every night. Should I be worried? It's because you are giving baby tea. You just stop it. You don't need to give baby tea every night. If you it's an habit. Sometimes we ask questions like, babies do this, and I'm like, you give the baby this. They don't do it by themselves. You've never They just love it. But if you start to let them know that, and it's not a good thing to give babies tea at night, but really when it is time for them to stop bedwetting to be an issue, let them take it in the daytime. Actually, in the morning time is better than taking it at night as well. Okay, somebody said I can hear you. Thank you. That was the last time. Oh my goodness,
Okay.
there's so much question.
Time, a
Okay.
lot of questions there. So I think I will advise our mothers to post it on our
Oh, la,
Facebook
la, la,
group.
la, la. Okay, fine. Let me just see what I can do in 5 minutes.
Okay,
Um,
ma. Okay, ma.
Ajayi, my teeth broke his front tooth, blah blah blah. Can the teeth still remove? You have to see a dentist because your baby is already past the age of make teeth, so you need to see a dentist first. If you cannot grow back, they will fix a artificial one for your baby, so there's nothing to worry about. uh 3 weeks old baby with a red spot at the back of the head. We need to see what the red spot is so that we can advise. Without seeing anything rash, we can advise. Okay, Doris say my 6 month old cough and catarrh have given her drug. What drug? How do you prevent cold and catarrh? So please post this question in our group. I have a whole list.
Yes.
Exclusive breastfeeding, make sure immunization, avoid crashes, daycare. Those are where most of them get it from. Those kind of things. So you get the full answer. Uh, 2-year-old vomiting with food. There's a problem. You need to see a pediatrician. What causes sepsis and the cure? Wow, that's a big one. You have
Right.
to post this on our Facebook groups and somebody will send you the link to that. Okay, thank you. Now time is up, so I'm just giving one line question. uh, Somebody say you need to see me. You want to see me? Okay, ask on the Facebook group. Somebody
Okay.
send the link on how to see me. Damilola
Oh, okay.
said, my baby, 1 month old, has got taken out to pediatrician, blah, 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 blah. Is still there. Should I be worried? You can go back to the pediatrician for a follow up. Let the pediatrician, are you exclusive breastfeeding your baby? That is the first question I want to know. Because exclusive breastfeeding protects against cough and catarrh, but if you are doing formula feeding, they are predisposed to having acute respiratory infection. My baby swallow a chicken bone. Wow. And I put
Oh.
my finger in her throat to help her put the and blood.
Ah.
Please take this baby to an emergency room
Oh God.
now. So did the bone come out? Anyway, you didn't tell her whether the bone came out, but please next time don't try to do what you did. It's a very dangerous thing to do. If your baby is shocking on bone or anything, that baby has to go to the hospital. It's an emergency. I don't know whether the bone kind of dislodged and went down, but I see, but because there was some bleeding and all that, I really think you still need to take your baby to the hospital and let a doctor look into that. Usually the ENT doctors have to do that. I'm really worried about that baby now. Cough and catarrh. You still see your pediatrician. Okay, finally. Baby cries out often. So babies cry because they dream. If your baby has cried during the day, when they sleep at night, they relieve the event that they've done during the day. If they've cried during the day, they can cry in their sleep. It is not a witch or a wizard tormenting the baby. It is just what we call REM sleep, So it is just baby acting out their dreams. It's nothing to worry. Just reassure the baby, pet the baby will go back to sleep. All right. If your baby has asthma attack and cannot sleep, you need to go to the hospital. That is not even, that's an emergency. Your baby most likely need to be on another drug to prevent the attacks. If your baby is having attacks so much, your baby has to be on drugs. We did, and I was with a ATP Live on asthma about a few couple of weeks back. So if you go back to our Facebook group, look for the ATP Live on bronchial asthma. Dr. Gbemisola was here and she answered all the questions on asthma. So please watch that. But I think you really need to go to the hospital. It's very, very important. So yeah, whole reacting to insect bites, blah, blah, blah. Hope the cream won't affect her. No, the cream should not affect her. But the baby also has tendency to have reaction to insect bite. So wear long clothing, cover the legs very well. Don't expose the baby to insect bite. That's what you need to do. There's nothing else you can do. 6 months old, teething, passing greenish stool, refusing to eat. It's not normal. Teething does not make a baby to have diarrhea. It does not make them to. It is not making them to refuse to eat. If your baby is sick, please don't blame it on teething. Take that baby to the hospital now, please. Baby vomiting after every feeding, it is not normal. You have to take baby to the hospital, but make sure it's not reflux. Reflux is different from vomiting. So reflux, baby bring out a little of the milk and it is effortless, but vomiting is active, with so much, you can see the baby, how do you use I'm looking for the right word now. You can see baby effort, forcefully bringing out whatever food, and it's usually a large
vomit.
Yes, and usually large and usually everything, and so that is vomiting. Vomiting in a child after feeding who always vomits. I'm quoting your word. Every word you've written is very important. Always vomiting, you need to go to the hospital because that is not normal at all. White patches on your baby's head. How old is your baby? They didn't even tell us. So it could be an infection, maybe fungal infection, but you need to show the white patches. If it is ringworm,
yeah, she can send the picture to our Facebook group.
Yeah, then we can advise you. White stuff in the eyes, clean it with water. Always tell the age of your baby. If you don't say some of this, we don't know what you're talking about. But you can clean with water. And if it's coming out, then you have to see you have to take the baby to the hospital. Blinking eyes frequently. It could be a tick. How old is the baby? 6 years old. The baby is blinking eye frequently. It's a tick. You may need to see a pediatrician depending. Does sleeping on the back cause flat head in the baby? No, it does not. Usually it's preterm babies that tend to have that. Preterm babies, but not the full-term baby. Sometimes they give that flatness of the head, but it's nothing to worry about because it will normalize eventually. But your baby need to sleep on the back so that they don't die from SIDS. That's more important than the shape of the head of the baby. Okay, a baby has adenoid. Adenoid, depending on the size, may go away usually, but sometimes it may not go away and they have to be operated. So you have to see an ENT doctor. They will look at it and then they will decide whether it's a type that may go away or it's a type that they need to operate. Usually we watch. But if it is giving a lot of problems, they have to go and remove it. If it's not giving so much problem, we can wait for it to stop on it, to shrink on it. So usually when they're about 4 5, that's when it does that. But if it's giving your baby a lot of problem, they may have to remove it. If you ask on our group, they will show you the group discussion on that. All right. Don't see, these are the problem. Don't sweeten complementary feed with Ribena. How can you be using Ribena to put in pap and then you say baby is vomiting? No, please, it is not
Ribena in the pap. Oh God.
Okay, so Facebook user, you need to go through the complementary feeding because you need there's a lot to address in your post. I don't even know where to start, but please just.
I think she can start with Eddie eating from the.
Oh, Allah has disappeared. Oh, taking bread all the time. That's your fault. Don't give the bread all the time. Don't give bread every day as well. It's not the right. Can the time for this program be increased? Yes, the time for this program be increased, but then we'll see what we can do about that. Omolara, welcome back. 4-year-old yes, in the house, sometimes without crying. Yes, sometimes allergy can make you to tear without crying. If there's no redness, nothing you can watch. If you are worried about it, you can see a pediatrician. Okay, what is the weight of a 1-year-old baby? 10 kilos, but 9.5 is not bad. It's okay. There's no need to worry. The helper just had a little bit to the weight, but it's not so significant. Don't worry about it at all. Ideally, we should wait without the helper, without nothing. Okay, BCG, Scar, can you post this question on our Facebook group? Somebody will answer that because of time.
Yes,
I need to go now. Bye, everybody. Okay, yes.
Thank you for joining us, everybody. We have to go now.
Okay, I think I've answered that one already. Okay, 1 year, which has not started working, no need to worry. 18 months, if the baby is not yet working, then see the pediatrician. So I think I've answered. So let me answer the BCG person because that's the only question I've not answered. So if the baby doesn't have a BCG scar, we need to test the baby to know whether your baby, you can have a BCG without a BCG scar, but we need to check that the baby actually has a reaction we get in a baby who has been immunized against BCG. And so there's a test we call Bantu Test. We do that Bantu Test. If your baby has a normal reaction to the Bantu Test, then there's really no need to repeat the BCG vaccine. But if your baby doesn't have a normal reaction to the Bantu Test, we have to check that your baby doesn't have tuberculosis currently. So we may need to do some chest x-ray and all that. If the baby doesn't have tuberculosis and doesn't have a reaction that we expect for BCG immunization from the Bantu Test, then we can repeat the BCG vaccine. So you have to see your pediatrician. They will do the Bantu Test, and then depending on the response, they will decide whether you still need to repeat the BCG immunization or not. So I think we have answered every questions now. Waking up now. So most of the Instagram questions, I've answered them. What you need to do is just watch the video again and you will get the answer to your question. So don't give Otrivin. It has to be prescribed. Only normal saline is what you can give as a mother without a doctor's prescription. So thank you so much. Sorry if
Thank you everybody for joining us, and we are very sorry for as many people that we didn't answer their questions.
So if you didn't answer your question, you can go to our Facebook group. Mondays to Saturdays, 24 hours every day, we answer questions. So post your question there. Myself, my colleagues, our moderators, other professionals, they will answer your questions within 72 hours. That's our contract. Within 72 hours, we'll try
also, you can check our apps out. Most of these questions are already on our apps. You can just check them out, download the apps. You don't have to even wait until Facebook answers. go on apps and check your question. You're going to get the answers to them there.
All right. Thank you so much, everybody. I'll see you next week, Monday. Bye for now.
Thank you so much, everybody. Thank you for joining us. See you same time next week. Bye.